What's up everyone? Welcome to my channel where I help practitioners, clinicians build a strong practice and up-level their business savviness. My name is Derek Chow. I am from Toronto, Ontario, Canada. I've been in this industry for more than 15 years and I've wanted to start this channel so I can help others through my own experiences. In today's video, I'm going to be treating the low back, specifically the QL and the Erector Spinae muscles through my specific techniques using my elbows. I find a lot of my clients experience a lot of low back pain, low back tension, especially after the pandemic now, where working from home is now the norm. So I've used this technique on a lot of my clients. I mainly work on the low back, specifically the QL and the Erector Spinae. So without further ado, let's get started. This session we're going to be talking about how to treat the low back. A lot of clients get low back tension, especially right above the hip area and into the QL. So today we're going to be massaging the QL or Quadradus Lumborum and also the the Erector Spinae. So right here. First off, I'm going to secure the draping here. Okay, so warm up the tissue as usual. From here, we're going to slowly sink deeper in. I'm going to use a effleurage right on the border. Okay. And now I start sinking my weight in. So approach it from the iliac crest, which is above the hip, side, and then we're going to go just lateral, so rotate just lateral of the Erector Spinae. So you're going to go deep underneath. So approach it from the side right here. You're going to pin it down. Give it a little bit of rock just to loosen up the muscle, loosen up the whole body, and then loosen up yourself as well. Okay, so now we're going to rotate, get into position, your legs into position. You're going to start sinking in. So use your whole body to sink in about 45-degree angle. So you're going to kind of scoop underneath and pin it down right here. So a lot of people get referral pain or referral sensation sometimes down into the glute area, the trigger point pattern. Okay, so from here, slowly lunge forward. At the whole time your body is leaning forward, your shoulder is stacked, so it's secured and stable, and then where you're moving is through your legs. So everything in the upper body is stable, the whole frame here is stable. So you're going to move very slow. You're using your forearms and your elbow, the point, to palpate where the highest tension points are, right? You're mapping out where the tension lines are. The whole time we're still at the lateral side of the erectors. Okay, so this is the low back area. So I'm starting to approach the bottom of the thoracic. So for today, we're gonna just focus on low back. So from here, I'm gonna go back down inferiorly, but at the same time, I'm gonna maintain that pressure downwards, and then I'm gonna move back. And then once I hit the top of the hip, so the iliac crest, I'm going to start to rotate again and come back out. And one more time. So I like to approach it from the side, right the side of the hip. So I get a 3D scan of the iliac crest. Okay, so I'm going to keep approaching to almost where the point of my elbow is. Okay, so once I secure the Erector Spinae, the lateral side, I'm going to start rotating down. At the same time, to get the QL, I'm going to scoop underneath. So think of the erectors as a semicircle here. So I'm going to try to get right at the base of the semicircle. Okay, once I pin it down, I start to lean my weight in. And then get my legs into position. We're going to go superiorly, so we're going to go up the lateral side of the erectors. So notice how slow I am. The slower you are, the more you're able to palpate, to feel out the changes in the contour of the muscle, right? Keep going all the way to about the thoracic level, and then we'll come back down. At the same time, you're always maintaining that pressure, 45-degree angle pressure. You're kind of scooping underneath, right? You're palpating with your elbow the lateral side of the erectors. Okay, you keep going. And then from here, once you reach the iliac crest, you're going to start to rotate back down and then flatten out and then end off with the nephrage. I hope you've found this video to be helpful and added new tools to your practice. Hit subscribe if you want to check out more videos like this one for the future. And in the meantime, peace out.